Our research has focused on the impact of income inequality, the gap between rich and poor in each society, and the relation that that has to health and well-being. And we've found that income inequality is related to lower levels of population health and a whole range of social problems, but also to inequalities in health, the gap between rich and poor in health outcomes in different populations, the steepness of the social gradient in those health problems.
And the reason why income is so important is because it brings together a whole network of causes. So it not only affects educational disadvantage, it also affects all the sort of behavioural things in health, like smoking and exercise, drinking. Income is also important because the lower your income is, the lower your social status, the more stressful people's lives are. And stress itself has very important health effects through all sorts of biological pathways affecting the immune system and the cardiovascular system. So people who are more stressed in the long term become more vulnerable to a whole range of illnesses.
How we deal with that cannot be the responsibility of just the National Health Service. The NHS is set up to treat diseases, to deal with people's health problems, which of course is essential, but it has very little role to play in preventing people from becoming sick or unwell in the first place. And that's why I think it's a good thing that recently responsibility for public health has moved out of the NHS and back into local authorities where it used to belong, because at least there's an opportunity to deal with the role of education, early childhood intervention, public transport, parks and green space, but also perhaps to start to deal with income inequality, poverty and deprivation.
Yes, I think the overall point is that government bears the main responsibility for the scale of inequality in a society. Not only income differences, but educational differences, housing differences, all sorts of things like that contribute to health inequalities. You can either reduce income differences by redistribution. At the moment, taxes are not progressive anymore. It used to be true that the rich paid a higher proportion of their income in taxes than the poor. That's no longer true. But the other way of doing it is reducing the income differences before tax. The initial pay people get, market incomes as they're sometimes called. In the past, trade unions have been quite important, and the whole of the labour movement in reducing income differences. But I think we now need to use other methods, particularly forms of economic democracy. When I say economic democracy, I mean everything from having employee representatives on company boards, as many of our fellow members of the European community have, to more support for cooperatives, employee-owned companies. I think we must deal with this very fundamental problem of health inequalities by extending democracy into the economy. The main problem that's caused our income inequalities to rise is that the rich have run away from the rest of us, and we have to find a way of capping that.
So much of policy that's aimed to reduce health inequalities is focused on changing individual behaviour, getting people to stop smoking, eat better, exercise more, take responsibility for their own health, and that ignores the fact that the broader social determinants of health are causing those behaviours in the first place. It's like mopping up the floor when the bath is overflowing instead of turning off the tap.